Crystal arthritis include a class of inflammatory arthritis that involve presence of inflammation in the joints because of crystals inside the joint space. The most common cause of crystal arthritis is gout, which is a very old condition, and it was known before as disease of the kings, and it's a result of accumulation of uric acid crystals inside the joint, and that results in inflammation, pain, and swelling in the joints. The uric acid, which is an end product of the food processing, could go up in the blood of people who have gout, and when it's above certain limits, it starts accumulating in the joints and cause inflammation. Why people would have high uric acid? Some of this has to do with their genes, and some with their diet, and some other condition such as diabetes and kidney disease. So people who eat a lot of red meat, seafood, and drink a lot of alcohol, they have a higher risk of having high uric acid in their blood, and as a result, gout. Also, people who has chronic kidney disease, diabetes, and people who has extra weight, they could have higher risk of having high uric acid and gout as a result. What do you do when you have gout? First, you need to have your rheumatologist confirming the diagnosis 100%. And the gold standard for the diagnosis of gout would be to see these crystals in the joint fluid. So your rheumatologist could tap the joints, look under the microscope for the crystals, and if they found them, you have your diagnosis. Once you get the diagnosis, the treatment would include two different ways of treating the gouts. First one, which is treating the acute flare. If you have a gout flare that often likes the big toe, it could be very painful, and the treatment would be strong anti-inflammatory such as naproxen, indocin, and prednisone. Oftentimes we use another anti-inflammatory medication called colchicine. So these are the main medication for the gout flare. The main thing to know about colchicine, it's very, very commonly used in gout flare, but it could result in some cramps in the abdomen and diarrhea. So patient needs to be aware of that. The second way of treating gout is what we can call a long-term investment in gout, which is trying to work on lowering the uric acid and hopefully decreasing the risk of having more gout attacks. And to do that, we have several medications. Some of them could be used by mouth, such as allopurinol and Uloric, and other medication that sometimes we use as IV, such as Cristixa. The second common cause of crystal arthritis is named CPPD arthritis, or pseudogout. This is another inflammatory arthritis that results from inflammation and presence of crystals inside the joint space. In pseudogout, the type of crystal in the joints is usually calcium crystal, and that causes inflammation, joint swelling, and pain. Pseudogout is very common in older population, and up to 4 to 7% of general population could have pseudogout. The presentation of the disease could be as acute flare, when one joint gets swollen, painful, and then calm down, and could be also chronic joint pain and swelling. Pseudogout's treatment is similar to how we treat gout. Sometimes we use anti-inflammatory, like non-steroidal anti-inflammatory or NSAIDs, including naproxen, Aleve, ibuprofen, and Motrin. And sometimes we also use colchicine and some other anti-inflammatory drugs that could be used to help lowering down the level of inflammation in the body. Pseudogout is oftentimes associated with other conditions, such as something called hyperparathyroidism, which is an increase in the activity of small glands that they're close to the thyroid gland here, and when they over-secreting, that could cause increase in the level of the calcium in the body and result in pseudogout. Other conditions that could be associated with pseudogout could include low magnesium level in the blood and low phosphorus level in the blood.